Great. Thank you for being here today to talk about a board letter that I'm bringing tomorrow regarding Medi-Cal. Business as usual is making our region sicker and poorer, but today we're launching an effort to change that. We're here to shine a spotlight on a critical issue within our healthcare system, one that has been overlooked for far too long and one that affects all of us. This is an issue that hurts the people it was designed to protect, while impeding access to healthcare and eroding its quality for every resident in our county. Medi-Cal, our state's Medicaid program, is a vital lifeline for families in our region. Nearly 1 million people in San Diego County, including 325,000 children, rely on Medi-Cal. But it's a lifeline that's dangling out of reach for many because low reimbursement rates are making it harder for folks to get the care that they need. On average, America's hospitals receive payments of about 88 cents for every dollar spent on Medicaid patients. In 2020, that equaled an underpayment of nearly $25 billion in total. And California ranks near the bottom when it comes to Medicaid reimbursements. This problem is not confined to those it directly serves. Instead, it ripples throughout our communities, impacting every one of us. You see, when healthcare providers are drastically underpaid for the care they provide to Medicaid beneficiaries, the entire healthcare system bears the brunt of this financial strain. It makes it harder for people to find care, contributes to a shortage of healthcare workers, and results in more San Diegans winding up in the ER. This means longer wait times, fewer beds available, and increased stress and burnout for healthcare workers. So tomorrow, I will urge the Board of Supervisors to approve a series of actions to address these issues and to make the paper promise of healthcare coverage a reality for everyone in our county. The plan focuses on enhancing access to and quality of healthcare by increasing reimbursement opportunities for healthcare providers. I'm asking county staff to conduct an analysis of Medi-Cal reimbursement services provided by the County of San Diego, including identifying ways to leverage existing resources through intergovernmental transfers and seeking ways to obtain more Medicaid matching funds, really looking hard at the things that are working in other parts of California and across the United States, and identifying ways to optimize Medicaid revenue and reimbursement services provided by counties, exploring new and additional sources of funding that could be available to the county to increase Medi-Cal reimbursement, and looking at ways to enhance reimbursement rates and incentivize providers to expand access to Medi-Cal services in San Diego County. I'm also asking the board to take on an issue that's of huge importance to millions of San Diegans: exorbitant prescription drug prices. No one should have to worry about being able to afford the medication we need. So part of this proposal that I'm bringing forward tomorrow is to push for action to reduce prescription drug costs by having San Diego County advocate for legislative actions at the state and federal levels to tackle this crisis head on. We're working to make our county take an active role in addressing the root causes of high drug prices and implement real solutions to save San Diegans money. The challenges that I've laid out are also compounding the severe healthcare workforce shortage we're already facing across our region and our state, putting extra strain on our healthcare providers and impacting access to essential health coverage. We have representatives of those workers here with us today. So first, I'd like to introduce Dave Reagan, the president of SEIU UHW. Dave?
Thank you. Good morning, and thank you to Supervisor Lawson-Remer. As she said, my name's Dave Reagan. I'm the president of SEIU United Healthcare Workers West. We are a healthcare workers union representing about 110,000 healthcare workers across the state, including about 2,000 here in San Diego County. And in addition to all of the policy reasons that the supervisor just gave for why tomorrow's launch of this undertaking in the county is so important. I also think it's important to just acknowledge that what we are about to embark on tomorrow is really the result of a new brand of leadership here in San Diego County. I want to appreciate Supervisor Lawson-Remer for doing this. And I also want to say to healthcare providers across the county that healthcare workers and healthcare worker organizations, we believe in the policy mission. We're prepared to do our part to make sure we build a more fair and equitable Medi-Cal system here in San Diego County. As the supervisor said, it really is about people. Medi-Cal is the insurance that about 1/3 of Californians, including San Diegans, now have. It's the single largest healthcare insurance program now in the country after the implementation of the Affordable Care Act. And it can do so much more for so many more people to improve access, to improve quality, to improve timeliness of services that are available, as the supervisor said, to 1 million people. But there's a political opportunity here born out of new county level leadership, and there's also an opportunity for healthcare providers to hopefully turn the page and to start in a new chapter of working with healthcare workers and healthcare worker unions, as opposed to the kind of engagement that we've seen historically in this county. And so on behalf of our members in SEIU UHW, I want to acknowledge the new political and policy opportunity, and I also want to call on healthcare providers in San Diego to join us in embarking on a fresh start. Let's do what's right for the common good for 1 million people. Let's create a new safety net system here in San Diego. And we're optimistic and enthusiastic about what can be done in the near future. So we're proud to be here. I'll return it to Supervisor Lawson-Remer. Thank you.
Thank you so much. Now I'd like to introduce Chris Howard, the President and CEO of Sharp Healthcare. Chris?
Thank you, Supervisor Lawson-Remer. And on behalf of Sharp Healthcare, I most certainly want to thank the supervisor for recognizing the significant negative impacts of Medi-Cal's low reimbursement rates and for bringing forth this proposal to explore opportunities for the county to increase Medi-Cal reimbursement rates, which would dramatically improve access to care for healthcare across this county. This is an issue at Sharp that we've been working on with the California legislature for years, if not decades. Medi-Cal reimbursements in California have not been increased for 12 years. Today, and the supervisor mentioned that nationally, the American Hospital Association states that 80 cents on the dollar is paid for Medicaid services. At Sharp Healthcare, it's less than 70 cents on the dollar for healthcare services provided to Medi-Cal recipients. And that shortfall adds up quickly, especially for Sharp Healthcare, because we're not only the largest healthcare provider in San Diego County, but we're the largest provider of healthcare for Medi-Cal recipients. A business, even a healthcare business, must live off of one simple principle. One ultimately has to receive reimbursement that equals or exceeds the cost of having provided the care that we provide. The approach under consideration by Supervisor Lawson-Remer to utilize various fundings as well as intergovernmental transfer funding mechanisms has been utilized in other states to provide significant increases in Medi-Cal, or Medicaid as it's called in other states, reimbursement. We so appreciate the supervisor's leadership and the recommended county actions, which signify the county's commitment to uplift and improve access to care for all. Sharp is proud to stand with the supervisor, as well as our labor partners and indeed healthcare partners from around San Diego County, to seek options to address the impacts to the patient care continuum, the healthcare workforce, and the community directly tied to Medi-Cal's insufficient reimbursement for care. Thank you.
Thank you so much. So now I'd like to introduce Jose Munoz. How do I say? Munoz. Jose Munoz, a local resident who can share his experience trying very hard to navigate the Medi-Cal system. Jose?
Hello, my name is Jose Munoz. I live in downtown San Diego, and I have been a Medicaid recipient since 18. I'm 23 years old and have been a Medicaid recipient since I was 18. Finding a healthcare provider who truly understands my needs has been challenging. I struggle with depression, anxiety, and OCD, and as a Medicare recipient, accessing quality mental health services has been an uphill battle. I've experienced lengthy waiting periods for appointments, only being able to book once a month sessions, maximum 8 per year, and I need more than that. Therapists often leave or are replaced or cancel at the last minute, which disrupts the continuity of care I urgently need. High turnover rates among staff and frequent cancellations mean that I've had to repeatedly recount my story to new healthcare providers, which is demoralizing, emotionally exhausting, and impedes any healing process. Navigating the complex system and having to wait for long times for inconsistent appointments has further damaged my mental health, especially when I've needed to see someone urgently during crisis periods. Because I wasn't able to get the proper amount of care I needed through my original provider, my mental health deteriorated so much that my therapist told me that my provider couldn't address the severity of my case anymore. Instead, I had to be referred to the county for specialty and more immersive intensive care. The county's mental health services are strained and overwhelmed, resulting in frustratingly long wait lists and complicated appointment scheduling processes. On my first visit, I was told that it was a first come, first serve situation. So I got up early and went to the county to try to be there first. However, when I got there, I was told many people had already been waiting days or weeks for an appointment slot before me. And as they could only see a small percentage of people daily, I was turned away. I went back several times, making sure to get there by 8 a.m. as I was told to do, but I stopped going after I couldn't get an appointment. The county is so backlogged with cases similar to mine, and with patients who have been trying longer than me to get an appointment, that it feels impossible to get any kind of treatment. My mental health struggles and challenges in accessing care affect my concentration, emotional stability, and overall job performance. My story highlights the urgent need for increased funding and support for Medicaid to address the glaring gaps in San Diego's healthcare system. By investing in accessible and comprehensive health services, we can ensure that individuals like myself receive the support and treatment necessary they need for their recovery and well-being.
Thank you, Jose. Your story is really an illustration of why we are here today. So tomorrow, my colleagues will vote on this proposal during our Board of Supervisors meeting, and I urge them to support our efforts to make quality health care more accessible and affordable for everyone in San Diego County. And if there are any questions, we are available to answer them. Thank you.